My goodness. Okay, well, today's health headlines, we're talking about September being Prostate Cancer Awareness Month. Time now to bring attention to one of the most common cancers in men. But with early detection and advancements in treatment, outcomes are improving. Joining us this morning to talk about prostate cancer, Dr. Michael Leitman, the leader of the Prostate and Urologic Cancers Program at Yale Cancer Center. Doctor, thanks so much for joining us today.
Thanks so much for having me.
Well, let's start with, according to the American Cancer Society, prostate cancer affects 1 in 8 men in their lifetime. Can you explain who is most at risk for prostate cancer and why is early detection really so important?
That's exactly right. About 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Just about every man is at risk for a diagnosis of prostate cancer in their life. It's just something that happens to men. It's, as far as we can tell, not strongly linked to a specific environmental cause or what we eat, but genetics plays a very strong role.
Now let's talk about screening for prostate cancer. What are the current recommendations and how are some of these new tools that we're seeing, including PSA testing and imaging technologies, really helping to catch cancer earlier?
So what we're seeing is the evidence continues to show that screening earlier in life has the maximum benefit because so current guidelines recommend beginning around age 50 to screen with the PSA test. And it's a simple blood test that looks for a protein that's made by the prostate. And if that level is elevated, it's a reason to go get checked out further. So it's a simple blood test. You don't have to think too much about it. And it gives a result that can help your doctors point you in the right direction.
No, you just mentioned the age of 50. Is that about when you suggest men really start going and getting those annual checkups with their doctors?
That's right. About age 50. Now, if people are higher risk, like a first-degree relative, a brother or father with prostate cancer, we recommend starting even earlier at 40 or 45, or if they have a known genetic condition that predisposes to prostate cancer. But 50 years old is a good recommendation for the average guy to start getting checked for prostate.
Okay, now let's talk a little bit more about that personalized medicine aspect when it comes to prostate cancer treatment, including active surveillance for low-risk cases. Can you explain and kind of break it down for us what this means and how it's changing the way that this prostate cancer is managed?
It's a great point. I think the key word here is precision. And so for years and years, prostate cancer was kind of treated with a one-size-fits-all approach. If you were found to have prostate cancer, you got treated right away. What we're realizing is that no two people are alike and no two prostate cancers are alike. And so we have tools like MRI, genomic testing, lots of ways to figure out what each cancer may behave like.
Oh.
And so a lot of men we see have cancers that are not aggressive, and we do a protocol of careful monitoring without treatment that can spare some of the side effects of treatment. We call that active surveillance.
Really interesting. So many advancements.
Absolutely. And it's also helping us figure out if someone does have more aggressive cancer that we can tailor and customize the amount of treatment we give as well.
Really interesting. Dr. Leitman, thank you so much for joining us as we wrap up this Prostate Cancer Awareness Month of September.